Hello, everyone. I'm Councilmember Kim Pine, and we have a very special guest, Coby Torda, and his husband, Scotty Staples, who are sharing their story, journey through surviving COVID with all of us. And as you will see today in our discussion, that this is not just the flu. And we'll also learn today what happens to the body when you have COVID, even to a healthy, athletic man that had a great future physically. And so I want to thank them for joining us today. Hi. Look at the handsome boys. Look at you guys. I wanted you to come on because I'm having a difficult time convincing people in Hawaii that this is the real deal.
So Coby got sick right at the beginning of the pandemic. So it was kind of around the time that nobody was really taking it seriously, I think. Like I was still working. We knew about the coronavirus, of course, but it hadn't really hit the state very hard. So nothing had happened in terms of shutting down or stopping work or anything like that. We were planning on just waiting it out and not really getting any kind of help medically. And I think that was our first big mistake because we didn't take him to the doctor. He didn't get the coronavirus test until days later. By the time we got the results back, he was really sick and was in hospital on a ventilator in a coma.
I started showing symptoms like 10 days before I was admitted. I was having high fevers, body aches, big chills. We went to Queens to go get a test, and it took over a week to get results, and I still didn't get results. I was already in Kaiser when they administered another test on me, and that's when I found out. Well, I didn't find out. I mean, I was already COVID positive when I was intubated.
The next time I saw him, he was already in the hospital room in a coma, intubated, and then I wouldn't see him awake until 2 months later. He was really, really sick. We would talk to the doctors every day. It was tough as well because there was no one to seek comfort in because we weren't allowed to see anybody. My sister had just had a new baby and I couldn't go and see her or her baby or anything like that. Plus I had my husband in hospital. So it was a real tough time.
And so that must have been the hardest part, Scotty, that you and your mother-in-law and father-in-law and the family couldn't go see him.
Yeah, the doctors were actually getting cross with me in the end because I was asking so much to go and see him. And I knew that as well, what you just said about there being scientific evidence about being in the presence of loved ones, helping your recovery. He had a team of very skilled doctors and nurses
and respiratory
medical professionals with him. And they were able to save his life.
Tell me about, what was the first symptom that you had, Coby?
Fever, that I can remember. And then body aches, and then the loss of taste and smell. I had pretty much almost every symptom except for like diarrhea. Thank God. The fevers wouldn't like go away. I was like hitting 104. The last, 5 days before I was admitted.
Usually fevers, you have it and then it breaks the next day if it's like right? But 5 days is a long time. And so I can see you're still having a hard time breathing, right? Is that the cough that happens? You just have this shortness of breath when you're talking?
Yeah, you can't talk for too long because it starts to come up. The coughing fits that he has.
And the coughing spasms and shortness of breath.
And they last for a long time too.
And tell me about his journey to recovery, problems with the body now, so that people understand that, because I have young people going out there saying, I'll get it and I'll be fine. I think they need to know that we're seeing all across the world young people who get it, who have major problems after.
I think one of the biggest kind of misconceptions around this virus is that it's like the flu, that you get it and then you make a full recovery, but that's not true. We also have this tendency to focus on the mortality rate rather than the amount of people that have ongoing problems, long-lasting problems from having the virus. just because you catch the coronavirus and you don't die doesn't mean that it's not going to change your life completely. His doctors said that the long-term recovery is going to be kind of years or a lifetime. Like you can see he's on oxygen right now. We asked his doctor how long he was going to be on oxygen, and he couldn't. This is his pulmonologist, and he's a lung expert. He couldn't even give any indication on how long he might be on oxygen. He said it could be years, it could be forever, because the virus is such a new virus. In terms of the recovery, he's made really good recovery so far. His lungs are still not fully functional, and it's not clear if they ever will be because of the complications from the coronavirus. He had this condition called ARDS, ARDS. It's acute respiratory distress syndrome. That condition, it kind of just attacks the lungs, and the doctors, they put you on a ventilator and try and get you to the point where the lungs will start to heal, but they never really heal. They'll never get back to where they were. He's got damage on his lungs now, scar tissue. That's what I think that people should try and keep in mind. Not we should go and get the virus so that we're immune to it. More like if we do get the virus, we could end up seriously damaging our lungs to the point where they'll never return.
I know that he had a hard time walking. Was the walking and other functions just because he was in a coma, or is this also something caused by the COVID?
I think it's more from the coma, like just being in the bed for like 6.5 weeks. My body pretty much wasted away. I have a lot of scars on my body. Lost a lot of muscle. Yeah, when I remember waking up, I couldn't even hold my phone when I wanted to FaceTime with my family, and just getting bedside assistance to use the bathroom was really pain.
The scars that he was talking about were from many different things. He got what they call decubitus ulcers, the pressure ulcers. Yes. It's from lying in the bed, and then your bones start to cut off the circulation to your skin, and then it forms these horrible ulcers. And so now he has these scars kind of on the backs of his feet and elbows, and then he also had to have a tracheostomy performed, so he has the scar on his neck, and he had a feeding tube too, so there's another scar on his belly. So many things that happened. There are so many complications that can happen from coronavirus. It's not just like you can't breathe.
What are you doing now? Do you feel that every day you're getting better though? Do you feel hopeful?
I mean, that's how I feel. I mean, I'm trying to be optimistic. I wake up, I got like my morning routine down. I have breakfast with my mom and Scotty. I do my walk outside along the house for like 20 minutes to a half an hour.
I can understand that breathing is the hardest, most frustrating thing for you.
Yes, it is. When I talk, like right now, I'm panting, and it makes me nervous sometimes. It's a little bit frustrating. And then when I'm out in public too, dragging those oxygen tanks is a bit of a hassle.
Do you want to see the setup, like the oxygen setup?
Yes, I would love to see it. I think people need to see it.
So this is Coby's tube. He carries this around the house, and it's about 30 feet so that it can reach everywhere. But if we can follow it, how 75 feet so that it can reach everywhere. But we can follow it all the way to this oxygen compressor, which we have to have at our house so that you can get a continuous supply of oxygen. It's noisy. Can you hear it?
Yes, I do.
So this just goes constantly. It's electrical. So just in case there's a power outage, they've given us one of these enormous oxygen tanks, which I keep next to my telescope. And then.
So what does he have to drag with him? The tank or that other thing?
So this is if he wants to leave the house, and he has this, and it kind of just wheels around like this. So it's not easy. It's a hassle. He got to wheel that behind him everywhere he goes. So we'll go to the gym and he's kind of got that with him at all times so he can breathe. He's never supposed to be without oxygen, the doctor said. So he's carrying that around whenever he leaves the house.
What do you want to tell the people out there, and anyone can talk on this one, who believe that they don't need to wear masks, that we don't need to take this seriously?
Say that, just don't be selfish and be considerate to others. Maybe you're healthy, maybe you feel invincible, maybe you don't care though, but there's a lot of other people's lives at stake. So just be very considerate.
We have some friends who are doctors. They said that the mask is not primarily to protect you, it's to protect others around you. You don't want to wait until it happens to somebody you love before you start taking it seriously, because you wouldn't be able to imagine the guilt that you'd feel if you infected somebody who was close to you and then something was to happen to them. It's nothing really to be complaining about. It's not so much of an inconvenience, because look at Coby, like this is an inconvenience with the oxygen, carrying that around everywhere. That's very inconvenient. If wearing a mask is the worst thing that you have to worry about, you really don't have anything to worry about at all.
And I understand it now, and it's hard in Hawaii to not hug somebody that you love, and it's been a total culture change for us, but we understand now that we can possibly hurt someone. Talk about the economics of this for you folks. So you both are in the tourism industry, so you both, I'm assuming, don't have jobs. Are the medical bills still piling up? I know we had a problem with which the insurance pays, but we got that figured out for you.
Yeah, I mean, able to get by because we had the unemployment checks coming in from the federal government, the $600.
Yeah.
So that was kind of getting us through. The medical stuff has been all sorted out. Kaiser and HMSA kind of sorted that out for us, so we don't have to worry.
It took a while. It took a while. I just hated having that $1 million bill,
it was just
lingering over my head.
They were sending the bills to us.
They kept sending it to us, and we were like, really, what am I supposed to pay?
Yeah. We didn't want to deal with it. We stopped opening the mail for a little while. We just like, oh yeah, most of the costs that we have now are just related to his recovery. So we had to make some changes around the house, like some renovations. Financially, we're okay because his family are helping us out. As far as the job front, I don't really know, because I work for the Sheraton and they're completely shut down. I don't know when the tourists are going to come back. I really don't know when I'm going to be going back to work.
Yeah, I'm just glad we got the medical thing, because when I heard about that, I almost used my city council card. It'll start blowing things up, right? I'm so mad.
Yeah.
I want to thank both of you for sharing your story. We're going to be praying for all of you and your family. We love you. We appreciate you telling your story. And we thank you so much. And we look forward to great things from you in the future.
Thanks, Kim.
Thank you, Kim.
Having us.